What is unemployment? Unemployment is referring to a situation in which a person who is actively searching for employment is unable to find work. Unemployment is considered to be a key measure of the health of the economy. The most frequent measure of unemployment is the unemployment rate, which is the number of unemployed people divided by the number of people in the labor force. Many governments offer unemployment insurance to certain employed individuals who meet eligibility requirements. Also, unemployment can be defined as the state where people are out of jobs to a variety of reasons. There are several different types of unemployment, including macroeconomic as well as individual factors. Unemployment can cause severe negative effects not only for individuals but also for the overall economy.
Low level of education. People without a high school diploma have a harder time going ahead in life, have poorer health, and are poorer than those with a college. One, poor health, a loss of a boy's shortened lifespan, unemployment, exploitation, and gender equality are all major sequences of a lack of knowledge. Mental issues. Mental illnesses or mental disorder are illnesses that impact your thoughts, feelings, emotion, and behavior. They might be short-term or long-term, chronic. They can have impact on your capacity to interact with other interfunction on daily basis. Physical health problems. The most common health issues. Physical activity and nutrition, overweight and obesity, substance abuse, HIV and AIDS, mental health, injury and violence, environmental quality, immunization, access to healthcare. Physical activity and nutrition, staying physically active has been shown to help prevent or delay certain diseases, such as cancer, heart disease, and diabetes, as well as reduce depression and enhance mood. Inactivity is a common side effect of growing older, but it doesn't have to be. Look for exercise and walking programs in your local churches or elder centers and retail malls. If you live and eat alone, your eating habits are likely to be poor, just as they are with exercise. It's critical for healthy aging to consume nutrients-dense foods while avoiding empty calories found in candies and sweets. Overweight and obesity. Being overweight or obese increases your chance of dying from hypertension, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, osteoarthritis, respiratory problems, breast, prostate, and colon cancer. In-depth guides or practical advice about obesity are available from the National Heart, Lung, and Blood Institute of National Institutes of Health. Substance abuse. Substance abuse usually means drug and alcohol. These are two areas we don't often associate with seniors, but seniors, like young people, may self-medicate using legal and illegal drugs and alcohol, which can lead to serious health consequences. In addition, seniors may deliberately or unknowingly mix medication and use alcohol because of our stereotypes about senior citizens. Many medical people fail to ask seniors about possible substance abuse. HIV or AIDS. Between 11 and 15% of US AIDS cases occur in seniors over age 50 between 1991 and 1996. AIDS in adults over 50 rose more than twice as fast as in younger adults. Seniors are unlikely to use condoms, have immune system that naturally weaken with age, and HIV symptoms are similar to symptoms that can accompany old age. Again, stereotypes about aging in terms of sexual activity and drug use keep this problem largely unrecognized. That's why seniors are not well represented in research, clinical drug trials, prevention programs, and efforts at intervention. Mental health. Dementia is not part of aging. Dementia can be caused by disease, reaction on medication, vision and hearing problems, infection, nutrient imbalance, diabetes, and renal failures. There are many forms of dementia, including, and some can be temporary. With accurate diagnosis comes management and help. The most common late in life mental health condition is depression. If left untreated, depression in the elderly can lead to suicide. Here's a surprising fact. The rate of suicide is higher for elderly white men than for any group, including adolescents. Injury and violence. Among seniors, falls are the leading cause of injuries, hospital admission for trauma, and deaths due to injury. 1 in every 3 seniors, 65 and older, will fall each year. Strategies to reduce injury include exercise to improve balance and strength and medication review. Home modification can help reduce injury. Home security is needed to prevent instruction. Home-based fire prevention device should be in place and easy to use. People aged 65 and older are twice as likely to die in home fire as a general population. Environmental equality. Even though population affects all of us, government studies have indicated that low-income, racial, and ethnic minorities are more likely to live in areas where they face environmental risks. Compared to those general population, a higher proportion of elderly are living just over prevented threshold. Immunization. Influenza, pneumonia are among the top 10 causes of death for older adults. Emphasis on influenza vaccination for seniors has helped. Pneumonia remains one of the most serious infections, especially among women and the very old. Access to healthcare. Seniors frequently don't monitor their health as seriously as they should, while a shortage of geriatricians has been noted nationwide. URMC has one of the largest groups of geriatricians and geriatric specialists of any medical community in the country. Your access to the healthcare is a close of as URMC offering a menu of services at several hospital settings, including the Via Hospital and Cardin Clinicua in senior housing and in your community.
The fourth causes of unemployment is gender discrimination. Workplace gender discrimination comes in many different forms, but generally it means that an employee or a job applicant is treated differently or less favorably because of their sex, gender identity, or sexual orientation. Even though the word sex and gender have different meanings, laws against discrimination at work often use them interchangeably. Sometimes workers experience discrimination because of their gender and something else like their race or ethnicity. For example, a woman of color may experience discrimination in the workplace differently from a white female co-worker. She may be harassed, paid less, evaluated more harshly, or passed over for promotion because of the combination of her gender and her race. The fifth cause of unemployment is mobbing. Workplace bullying is defined as persistent mistreatment that occurs in the workplace. It can include behaviors such as verbal criticism, personal attacks, humiliation, belittling, and exclusion. Workplace bullying has a negative impact on the health and well-being of employees. It can also have a negative impact on workplace productivity and performance. The sixth cause of unemployment is homelessness. Unemployment impacts on homelessness persons particularly hard given that they are often facing numerous challenges. The lack of access to employment contributes to homeless people not having sufficient and sustained income to meet basic needs. This is particularly so for those who do not receive welfare assistance.
For the first solution, better education. In order to fight unemployment, it is crucial to improve education levels of people so that it will be easier for them to find a job. This education should start early in school, and teachers should pay close attention and take care of every child to ensure good educational progress. Second solution is the motivation programs. Jobless people who are not willing to work at all have to be incentivized to get a job. This could mean that their social security levels may be lowered if they do not take action to go back to work. Last, program against drug addiction and homelessness. Before homeless people and drug addicts are able to get and maintain a job, these people often need support from social workers or programs in order to find their way back into society. This program should show these people a future perspective so that they are willing to take the hard way out of addiction and homelessness and start a new life. By doing so, we will be able to bring part of these people back into occupation.
Fight discrimination. We should also try to fight all sorts of discrimination as a society. This also includes gender inequality. In countries where women are still repressed and not seen as equally important as men, governments and celebrities should speak up and show the general public that women are important as men, and therefore, job discrimination due to gender is not a sensible behavior. By doing so, the job opportunities for women may improve since the acceptance toward them will be increased. Support programs for mental issues. Since mental issues often prevent people from having a job, it is crucial that these mental problems are treated appropriately so that we can reintegrate these people back into the workforce as soon as possible. People who are working in jobs that are mentally demanding should also take care of themselves in order not to be at risk for burnout. By taking these measures, individual unemployment can be reduced further. Subsidies for companies who are reintegrating unemployed persons. Many companies also refrain from employing unemployed persons, especially if these persons suffer from long-term unemployment. In this case, it might be sensible to provide financial incentives by governments for these firms if they are willing to reintegrate long-term unemployed persons into the workforce by offering them a job. By doing so, these people may be able to get a job and therefore may be able to get out of unemployment.
7 is fiscal and monetary measures in financial crisis situation. In case unemployment is due to financial crisis, central banks should take appropriate measures in order to get out of this crisis situation by applying fiscal or also monetary policy measures. These measures could help to stabilize the global economy and may prevent a further downward slope, which in turn would result in even higher unemployment. Thus, in financial crisis situation, it is crucial that the central bank takes suitable measures in order to prevent high level of unemployment. I think these policies were successful in helping many parts of the nation economy respond effectively to the first wave of the pandemic. 8. Fight structural unemployment. Structural unemployment is hard to fight and will take a quite long time. It can only be fought in government take action for a better qualification of workers so that the incentive for a companies increases to the employ these workers. It also has to be analyzed which kind of workers are needed in the respective region so that they can be qualified accordingly and are able to get out of unemployment. 9 is create jobs. An intuitive measures to fight unemployment is to create jobs. Jobs can be created in several different ways. The creation of jobs often involves raising the incentive for companies to employ people and open branches in weak economic regions. This can often be accomplished by giving firms financially incentives like tax advantage or other incentives to offer jobs for the local population.